This is an example of a lymphatic taping technique used to reduce swelling in and around the shoulder joint. The tape gently lifts the skin, facilitating drainage of fluid to the lymph nodes of the axilla. This reduces swelling. As the swollen area in this example is significant, 2 lymphatic fans are required to encompass the full area of swelling. The base point of the first fan is applied to the outer margin of the pectoralis major, close to the humeral attachment near the axilla. The fans are directed upwards and progress posteriorly over the shoulder joint to just beyond the margins of swelling. Mark the base point. With the shoulder joint in neutral, measure the tape to just beyond the outermost edge of the swollen area. Cut and prepare a lymphatic fan using 3 or 4 tails. Using more than 4 tails reduces the width of each tail, which may result in reduced speed and volume of drainage. Lay a base of 4 to 5 centimeters without stretch as an anchor. Tear the backing paper at the beginning of the first tail. Peel away the backing paper, leaving only a tip of paper at the end. While holding the tip between finger and thumb, stretch the tail between 10 and 20%, and while maintaining this stretch, lay down along the outermost edge of the swollen area. Repeat this process for the remaining tails. Allowing approximately 1 to 2 centimeters between each of the tails. When laying the final tail, ensure that the achievable mass of the swollen area has been encompassed by the first lymphatic fan. The base point of the second fan is applied to the posterior aspect, close to the humeral attachment of the latissimus dorsi. The fans are directed upwards and anteriorly over the shoulder joint to just beyond the margins of the remaining swelling. Mark the base point. With the shoulder joint in neutral, measure the tape to just beyond the outermost edge of the remaining swollen area. Cut and prepare a lymphatic fan using 3 to 4 tails. Lay a base of 4 to 5 centimeters without stretch as an anchor. Apply the second lymphatic fan using the same technique as the first. On completion, the entire mass of the swollen area should be encompassed by the 2 lymphatic fans. If they are not, additional fans may be applied. Advise the patient to expect a reduction in swelling and levels of pain within 24 hours. It is not essential to maintain the limb in elevation to assist the effects of lymphatic drainage caused by the fans. If swelling persists beyond the acute phase and the patient does not experience relief of symptoms, check the tape has been correctly applied or reconsider the chosen technique. However, further investigation may be required. Caution: certain patient groups with a history of cardiac and/or vascular disease may be contraindicated for excessive lymphatic drainage. If the patient experiences any unusual symptoms, the tape should be immediately removed and their therapist contacted. For larger diffuse areas of swelling, further drainage may be achieved with the application of an additional lymphatic fan, extending from the contralateral axillary lymph nodes across the anterior chest.